Hello everyone. Myself Srushti Patel from Family Third Year and I'm a student of Maliba Pharmacy College. Today I'm going to share you some detailed information about the drug name heparin. So as we all know, heparin is used as an anticoagulant all over the world, which is also known as the blood thinner. It is used to treat and prevent the formation of clot. So now we will see some more about heparin in detail. So, we will see about how heparin was invented, who invented it, and which class does heparin belong, what are its source, what are its pharmacokinetics, what are the clinical uses of heparin, through which mechanism does heparin acts, what are the side effects, contraindications, complications, what are the types of heparin, through which route we can administer heparin in patients, what are the dosage form available, and what are the antidotes of heparin. We will also see about how we need to counsel patients who are taking heparin. So, let's start. Heparin, history of heparin. So heparin was first discovered by J. MacLean and William Henry Howell in 1916, although it did not enter clinical trials until 1935. It was first originally isolated from dog liver cells. MacLean was a second-year medical student at Johns Hopkins University and was working under guidance of Howell, investigating procoagulant preparation. He isolated a fat-soluble phosphatide anticoagulant from canine liver tissue. In 1918, Howell coined the term heparin for this type of fat-soluble anticoagulant. In the early 1920s, Howell isolated water-soluble polysaccharide anticoagulant, which he also termed as heparin, although it was quite different from the previously discovered phosphatide preparation. In 1928, the physician and the physiologist Charles Best, he was known for his most famous work of insulin at Connaught Laboratory, Toronto, began to assemble a team of biochemists, physiologists, and clinicians. They aim to purify heparin to reduce or eliminate its side effect and to demonstrate its effect in prevention of thrombus formation. The first human trial of heparin began in May 1935, and by 1937 it was clear that Connaught's heparin was a safe, easily available, and effective as a blood anticoagulant. Now we will see the introduction of heparin. Heparin, also known as unfractionated heparin, that is UFH, is a naturally occurring glycosaminoglycan. Heparin is a non-uniform mixture of straight-chain mucopolysaccharides with molecular weight of 10,000 to 20,000. It contains polymer of two sulfated disaccharide units, that is D-glycosamine liduronic acid and D-glucosamine diglucuronic acid. Heparin carries a strong electronegative charge and is strongest organic acid present in the body. It occurs in mast cell. Thus, heparin is present in all tissue containing mast cell and richest source are lung, liver, and intestinal mucosa. Now we will see the class and category of heparin. As I have said earlier, it comes under the class of anticoagulant, which is also known as blood thinner. So, anticoagulants are of two types, that is parenteral anticoagulants and oral anticoagulants. But heparin comes under the parenteral anticoagulant. And in that also, heparin comes under indirect thrombin inhibitor. So, the reason behind why heparin comes under indirect thrombin inhibitor, we will see in mechanism of action. Now, what are the source of heparin? Heparin is commonly extracted from porcine intestinal mucosa and from bovine lung. Pharmacokinetics. Heparin is large, highly ionized molecule, therefore not absorbed orally but injected intravenously. It acts instantaneously, but after subcutaneous injection, anticoagulant effect develops after 60 minutes. Heparin does not cross blood-brain barrier or placenta. So it is a drug of choice during the pregnancy. And it is metabolized in liver by heparinase and its fragments are excreted in urine. So we will see what are the therapeutic uses of heparin. It is used in the treatment of venous thromboembolism and pulmonary embolism. Pulmonary embolism is a condition in which one or more arteries of the lung become blocked by the blood clots. So, heparin used in treatment of pulmonary embolism. It is also used in unstable angina, myocardial infarction, acute myocardial infarction, and arteriosclerosis. It is also used in during and after coronary angioplasty or stent placement. Low dose subcutaneous heparin is used in preventing venous thromboembolism. It is also used in treatment of acute and chronic consumptive coagulopathies, that is disseminated intravascular coagulation, which is also known as DIC. It is also used in preventing of clots in arterial and cardiac surgery. It is also used in deep vein thrombosis, which is also known as DVT, and it is a blood clot in deep vein which is usually present in legs. So this is the image of deep vein thrombosis. It is also used. Heparin is also used in blood transfusion, extracorporeal circulation, and dialysis procedure. Now we will see the mechanism of action of heparin. So here we will see why heparin comes under the class of indirect thrombin inhibitor. Heparin acts indirectly by activating plasma antithrombin 3, that is 83, which is a serine proteinase inhibitor. So here heparin binds with 83 and make a complex called heparin 83 complex. And then this complex will bind with the clotting factor of intrinsic and common pathway and will inactivate them. So the factors which are mentioned here, that is 10A, 2A, which is also known as thrombin, 9A, 11A, 12A, 13A are inactivated by this complex. Now, once 10A is inactivated, the conversion will not take place. That is, the conversion from prothrombin to thrombin will not take place because 10A is inactivated. And further, if thrombin is not formed, the conversion from fibrinogen to fibrin will also not take place because thrombin is only not formed. Fibrin, which is responsible for formation of clot. So once the fibrin is inactivated, the formation of clot is also prevented. So this was the mechanism of heparin. In this figure, same as I said ahead, same is written here. Heparin binds to the 83. Heparin binds to the 83 and makes a complex, that is heparin 83 complex. Then inactivation of thrombin factor and other protease, prevention of fibrin formation and inhibition of thrombin-induced activation of platelets, and factors 5 and 8, prevention of clotting. Now we will see the adverse effect of heparin. Bleeding is one of the most serious complications of heparin therapy. Hematuria is generally the first sign. Transient and reversible alopecia. Alopecia means hair loss. Thrombocytopenia means decrease in the count of platelets is also one of the major problem. Occasionally, serious thromboembolic event results. In some patients, antibodies are formed to heparin platelet complex and marked depletion of platelets occur. So heparin should be discontinued in such cases, and even low molecular weight heparin are also not safe in such patients. Now, osteoporosis means weakening of bones may also develop on long term of usage of relatively high dose of heparin. So this is one of the major problem. Hypersensitivity reaction are rare, but manifestations are urticaria means rash, rigor, fever, anaphylaxis. Patient with allergic diastasis are more liable. Now we will see the contraindications of heparin. First is bleeding disorder. Second is severe hypertension. Risk of cerebral hemorrhage, threatened abortion, piles, gastrointestinal ulcer, risk of aggravated bleeding. Subacute bacterial endocarditis, that is risk of embolism, large malignancies, risk of bleeding in central necrosed area of tumor, tuberculosis, that is risk of hemoptysis, ocular and neurosurgery, lumbar puncture, chronic alcoholic cirrhosis, renal failure. Aspirin and other antiplatelet drugs should be very cautiously used during the heparin therapy. Contraindications means in which medical conditions we have to avoid taking heparin. So these were the medical conditions in which we have to avoid taking heparin. Now we will see the drug-drug interaction. Heparin interact with Alteplase, antihistamine, antithrombin, cephalosporin, cefazolin, ceftriaxone, penicillin parenteral. Examples are ampicillin and penicillin G. Now, what is the route of administration of heparin? So, administration by intravenous infusion or subcutaneous injection is preferable. Now, what are the available doses of heparin? Heparin is conventionally given IV in a bolus dose of 5,000 to 10,000 units in children, 50 to 100 units per kg, followed by continuous infusion of 750 to 1,000 units per hour. Dosing in patient with thrombotic disease, IV infusion, 75 units per kg given IV as a loading dose. In children less than 1 year, initially maintained on 28 units per kg per hour, and in children more than 1 year, 20 units per kg per hour. Intermittent injections start with 50 to 100 units per kg per IV and maintain on 100 unit per kg given IV every 4 hours. Catheter patient patency. For infant less than 10 kg, 10 units per ml, and for children and infants greater than 10 kg, 10 to 100 units per ml. Renal dose 20 to 25 dose in normal renal function, 10 to 20 dose as in normal renal function, and less than 10 dose as in normal renal function. So now we will see what are the complications of heparin. The most and the serious complication of heparin is heparin-induced thrombocytopenia. As we have seen in adverse effect, there was also thrombocytopenia. So it is characterized by decrease in platelet count of more than 50% from the highest platelet count value after initiation of heparin. Heparin induced thrombocytopenia is an immune-mediated potentially fatal syndrome in which the heparin-induced immunoglobulin bridge platelets causing both thrombocytopenia and thrombosis. HIT does not include bleeding but rather results in paradoxical prothrombin state. Prothrombotic state is also known as thrombophilia. It is also known as hypercoagulability. It is an abnormality of blood coagulation that increases the risk of thrombosis, that is blood clot in vessels. HIT is most common in surgical than medical patient, especially in cardiac and orthopedic patient. Now, the types of HIT. There are two types of HIT. First, type 1 HIT is a non-immune disorder which is developed within first 2 days after exposure of heparin, and the platelet count normalized within continued heparin therapy. Type 2 is an immune-mediated disorder that are typically occur within 4 to 10 days after exposure of heparin and has life and limb-threatening thrombotic complication. Treatment of HIT. HIT is treated by discontinuation of all heparin products. The patient should be started with an alternative anticoagulant that is mentioned here. ergotamine, bivalirudin, and warfarin. Types of heparin. There are total 3 types of heparin. Unfractionated heparin, which is also known as high molecular weight heparin. Low molecular weight heparin, which is the second type, LMW. And the third type is fondaparinux, which is also known as a synthetic heparin. Low molecular weight heparin. Heparin has been fractionated into low molecular weight form. Molecular weight of LMW is 3000 to 7000 by different, and it is fractionated by different techniques. LMW heparin, that is low molecular weight heparin, have a different anticoagulant profile, that is it selectively inhibit factor 10A with little effect on 2A, that is thrombin. They act only by including conformational change in 83 and not by providing a scaffolding for interaction of 83 with thrombin. So as a result, low molecular weight heparin have a smaller effect on APTT, which is also known as activated partial prothromboplastin time, and whole blood clotting time than unfractionated heparin UFH relative to anti-factor 10A activity. They are eliminated by renal excretion and are not used in patients with renal failure. Thrombocytopenia is less frequent and a low incidence of hemorrhagic complication compared to UFH, that is unfractionated heparin, has been reported. So these are the most commonly used heparin marketed product available, which is available in market, most commonly used. So now we will see the difference between unfractionated heparin and low molecular weight heparin. So first, the mechanism of action. So unfractionated heparin activates antithrombin 3, which forms a complex inhibiting clotting factor 2A and 10A, as well as 9, 10, 9, 11, and 12. And low molecular weight heparin works by activating antithrombin 3, which forms a complex inhibiting clotting factor 10A, which only inhibit the clotting factor 10A, not 9, 11, and 12. Mode of administration. Unfractionated heparin is administered IV, and low molecular weight heparin is administered by subcutaneous route. Half-life of unfractionated heparin is shorter as compared to low molecular weight heparin. Low molecular weight heparin half-life is longer, that is 3 to 6 hours. And in fondaparinux, which is a synthetic heparin, we will see ahead, its half-life is 17 to 21 hours. Side effects of both heparin are same, that is bleeding, osteoporosis, thrombocytopenia, that is HIT, which is also known as heparin-induced thrombocytopenia, and hyperkalemia. Reversibility, we will see this ahead, that is rapid reversible by protamine sulfate. Useful in situation where rapid reversal is required. And low molecular weight heparin is partially reversed by protamine sulfate. Useful in uses in renal failure. So unfractionated heparin can be used in renal failure, but low molecular weight heparin are cautiously used in renal failure, especially in patient having GFR less than 30 due to increased risk of bleeding. Risk of HIT. Higher risk compared to low molecular weight heparin, and risk of HIT in low molecular weight is minimal. And fondaparinux, in fondaparinux, there is no risk of HIT. Now we will see about the fondaparinux, which is a synthetic heparin, the pentasaccharide with specific sequence that binds to 83 with the high affinity to selectively inactivate factor 10A without binding thrombin, that is factor 2, has been recently produced synthetically and given the name fondaparinux. The bioavailability of fondaparinux injected subcutaneously is 100%, and it is longer acting, as we have seen ahead in the difference, the half-life of endoperinax is 17 hours. Is contraindicated in renal patient because it is largely excreted unchanged by the kidney. Fondaparinux is less likely to cause thrombocytopenia compared to even low molecular weight heparins, and risk of osteoporosis after prolonged use is also minimal. So this is the marketed product of Fondaparinux, which is sold under the brand name Erixtra. So now we will see the heparin antagonist, that is antidote of heparin, which is protamine sulfate. It is strongly basic, low molecular weight protein obtained from the sperm of certain fish, given intravenously. It neutralizes the heparin weight, that is 1 mg is needed for every 100 units of heparin. Protamine is more commonly used when heparin action needs to be terminated rapidly. Example, after cardiac or vascular surgery. Protamine does not neutralize fondaparinux, and it not only partially reverses the anticoagulant effect of low molecular weight heparin. In the absence of heparin, protamine itself acts as a weak anticoagulant by interacting with platelets and fibrinogen. The ADRs of protamine sulfate are flushing and breathing difficulty. Now, how to counsel patients who are taking heparin? Patients should be cautioned and avoid to take IM, that is intramuscular injection. Patients should not take aspirin, ibuprofen, or other anti-inflammatory medicines, example NSAIDs, while using heparin. Advise patient to report usual bruising or bleeding, that is nosebleeds, bleeding gums, or tarry stools, to healthcare provider immediately. Advise patient that smoking and alcohol may alter response to heparin and therefore they are not advised. Inform patient that abrupt withdrawal of heparin may precipitate increased coagulability. Stay away from rough sports or other situations where you could be bruised or cut or injured. Be careful when you are using a regular toothbrush, dental floss, or toothpicks. This medication may cause serious type of allergic reaction called anaphylaxis. It can be life-threatening and may require immediate medical attention. Inform the doctor immediately about the rash, itching, swelling of face, tongue, and throat, trouble breathing, or chest pain after you receive this medication. Now, we will see some MCQs related to this topic. The first, the following can be used to antagonize the action of heparin in case of overdose. Option A, heparin sulfate, B, dextran sulfate, C, protamine sulfate, and D, NCOD. So the correct answer is protamine sulfate. Low dose of heparin prolong A, bleeding time, B, activated partial prothromboplastin time, C, prothrombin time. So the D, both B and C. So the correct answer of this is activated partial prothromboplastin time. Low concentration of heparin selectively interferes with the following coagulation pathway. So option A is intrinsic pathway, option B, extrinsic pathway, option C, common pathway, option D, both A and C. So the correct answer of this question is intrinsic pathway. Question number 4. Heparin is contraindicated in patients suffering from the following disease except A, pulmonary tuberculosis, B, bleeding due to defibrillation syndrome, C, subacute bacterial endocarditis, D, large malignant tumors. So the correct answer of this question is bleeding due to defibrillation syndrome. Question number 5. The primary mechanism by which heparin prevents coagulation of blood. So option A, direct inhibition of prothrombin to thrombin conversion. Option B, facilitation of antithrombin 3 mediated inhibition of factor 10A and thrombin. Option C, activation of antithrombin 3 to inhibit factor 9 and factor 11. Option D, inhibition of factor 12A and 13A. So the correct answer is facilitation of antithrombin 3 mediated inhibition of factor 10A and thrombin. So, thank you.